Back live and in focus. October is Mental Health Awareness Month in South Africa. Available research suggests that a quarter of South Africans suffer from common mental disorders such as anxiety, depression, or substance abuse. A large-scale 2012 study found that the Western Cape had the highest 12-month and lifetime prevalence rates, and the lowest rates were in the Northern Cape. Further found that the country ranks the lowest alongside the United Kingdom in terms of mental health treatment. Joining us now to discuss why the health system needs an overhaul to deal with the mental health care is practitioner, mental health advocate and lecturer, Dr. Alicia Porter of the South African Society of Psychiatrists. Dr. Porter, good evening and thank you very much for your time and joining us tonight here on In Focus. 1 in 4 South Africans had a common mental disorder like depression, anxiety, or substance abuse. Out of these, 1 in 10 are able to get medical assistance. They say about a quarter of mental health patients are readmitted to hospital within 3 months of being discharged. Clearly showing that there is a need for action on mental health in South Africa. This is indisputable and this is quite urgent. Why has there been, in your view, a lack? Why have we fallen short in terms of prioritizing our capacity development as far as responding to mental health?
Hi, good evening, Sabo. And yes, those are things that keep me awake at night. So I think the challenge within our health system, particularly with mental health, is the way the system is currently structured. So we are a very hospice-centric health system where we only have about 5% of the budget for health that's spent on mental health. And of that 5%, the majority is concentrated on hospital care and it's geared towards crisis intervention. And so, and most people who go to hospital or who need hospitalization are those with severe mental health problems, which only makes up about 1 to 3% of the population. Whereas our common mental health conditions like depression, anxiety, and substance abuse, there isn't much that is catered for them in the system, nor is there a focus on primary prevention or even early detection or the promotion of mental well-being. So it really is about how the budget is spent and also how the system is actually structured in terms of what the needs are of the South African population and what is then currently available.
What are the suggestions? What are the experts saying? I mean, there is an array of complex issues at play here, stresses that come at an individual level, at a societal level, socially, but also there are stresses that are structural in nature that are causing a lot of vulnerabilities, particularly also in the young people. So that 5% of the budget, how should it be spent to address those complex issues that are at play here?
I think that the budget needs to be allocated, and it needs to be distributed between the common mental health problems, because with COVID, we've seen an exponential increase in depression, anxiety, and substance use, whereas the severe mental health problems have remained sort of static because their etiology is more genetic, and those kind of things. And so there needs to be more prioritization given to, community care and upskilling of community health services. And mental health services need to be seen like any other health conditions. Like we have primary health care clinics, we have community clinics, but the mental health care rendered in these clinics is less than optimal at this point, particularly for children and adolescents, where, if we looked and we provided services within the community, that would definitely take the stress off, where if we made screening for the common mental health care problems mandatory, for example, at GP visits or mandatory, at primary health care clinics and empowered the staff at the clinics to deal with some of the common mental health care problems, or even just screening for them or detecting them early, I think that would go a long way, because I really do think that the saying that says prevention is better than cure is definitely true in this case. But we definitely have fallen very far short when it comes to prevention. And all we do is crisis intervention, and that then leads to the revolving doors that we often see, in our psychiatric inpatient facilities, where it's the same patients coming in and out constantly, and that definitely speaks to gaps within our system.
Yeah. How do we address, for example, psychosocial disorders or disabilities, particularly in a context of individuals who would experience these social stresses differently depending on where they are?
So, with regards to psychosocial disabilities, within South Africa, we definitely have quite a disparity in terms of our economy and even access to care. So that is quite a challenging, that's quite a challenge within the current healthcare system. But I think, again, it comes back to strengthening the community, because sometimes with psychosocial issues and concerns, we might not be able to change the situation, but we might be able to render support on a community level, with things like support groups and mobilizing communities to assist. So it would be communities helping communities and empowering at a community level, because institutions and, from a structural point of view, there isn't capacity at hospital level to actually assist where there are psychosocial issues that are at play.
So one of the areas highlighted in the report, of course, is the concern being raised over the future of mental health globally, but the key alarming findings is the mental well-being of the younger generation, which is now a global phenomenon. But if you look at South Africa in particular, you've got stresses that are brought about by, for example, unfavorable economic situations, an environment economically that is just not favorable. And those circumstances, include poverty, inequality, unemployment of young people. Are we saying until we address this issue, the mental health of our young people will continue to be at a deteriorating state?
100%. And that the problem with untreated mental health problems in young people is that the impact is a lot more significant, in that it does lead to a furthering or a sort of increasing the problem that already exists, because they're going to have a failure to launch. They're not going to achieve as well as they would. It's lost potential, and eventually it does impact on our economy if our youth of today are not productive adults of tomorrow. And a lot of the mental health problems actually go undiagnosed and untreated. And what we found is that the average age of onset, even of adult mental health problems, if we go back and look retrospectively, the average age is usually at the age of 14. And so when it comes to child and adolescent mental health, we really need innovation, we need collaboration, and we need to involve multiple sectors if we're actually going to get on top of the problem. I don't think it's just a Department of Health problem. I think it's a Department of Education, it's a Department of Health, and a Department of Social Development, together with possibly the private sector and corporate, coming together to collaborate to see how we can innovate. And the one thing with children and adolescents is that it doesn't matter where they are, on the economic scale. They have access more often than not to technology. So is the answer going to lie in, technology, and we use it advantageously with regards to this particular challenge when it comes to children? It's always a thought that I often have.
Yeah. It seems to me that the protective factors would also be quite limited by the fact that we are having limited responses at all those levels. For example, if you're saying one of the areas that we would need to be strong at is quality education, one of the areas that we would need to be strong at is decent work, one of the areas is safe neighborhoods, community cohesion, and I don't see all these sectors sitting around the table and talking to one another and saying, let's prioritize this issue of mental health.
You know, and that's the challenge, but I think if we can all come together and each person do their bit. So, for example, in education, just bringing mental health to school level, you know, where we empower teachers because they are our sort of eyes and ears on the ground. You know, in working with children and adolescents, it's usually the teacher who picks up a problem. So it's just going back to empower teachers with basic counseling skills, you know, empower them in terms of early detection and just screening and identifying at-risk adolescents. So we're not asking for, you know, things that necessarily are outside of their scope of practice, but it's just about how can we use the limited resources that we have in order to collaborate and empower, and you know, that may go a long way rather than, you know, expecting that it's going to be this cutting edge techno savvy advances, but just sort of coming together to collaborate, I think will go a very long way in facing these challenges, because it's a challenge that's not going to go away. And by continually burying our heads or denying that we have a problem is not going to make the problem smaller. We really do need to prioritize mental health because we are in the middle of a mental health pandemic. And I think that this has been further, you know, exacerbated by COVID. We had a problem before. We've got an even bigger problem now.
Dr. Alicia Porter, appreciate your time. Thanks so much for coming on. That's Dr. Alicia Porter from the South African Society of Psychiatrists.